Good morning. It's September 9th, and this is your daily brief in science. Here's everything you need to know. EcoWave Power is launching the first onshore wave energy pilot site in the United States at the Port of Los Angeles' Alta-Sea Ocean Institute. This project aims to demonstrate the viability of wave energy as a renewable power source. The company is also exploring international projects in Taiwan, India, Portugal, and Israel, and considering opportunities in New Jersey. Experts highlight that wave energy can provide consistent power regardless of wind or sunlight, and it has minimal impact on coastlines, making it suitable for remote coastal areas. The project is supported by funding from Shell and has navigated licensing processes efficiently, with potential sites along the U.S. coastline identified for further development. Industry leaders see successful pilot projects like this as crucial steps toward commercializing wave energy and integrating it into the broader renewable energy mix. This initiative reflects a broader industry trend where wave energy is moving from research to pilot projects and industrialization, with prospects for commercialization both domestically and internationally. The wave energy industry is planning to expand to other U.S. ports and international locations, signaling a shift from demonstration to industrial deployment. The project signifies a move toward commercializing wave power, with sites identified along U.S. coastlines that avoid land use conflicts. EcoWave Power's CEO Inna Braverman emphasized that wave technology could significantly contribute to clean energy and pollution reduction in port communities. While broader adoption depends on reducing costs, existing projects like Spain's Mutriku Harbor and Hawaii's offshore system already demonstrate the technology. EcoWave Power's system captures ocean waves by pushing cylinders with hydraulic fluid, which then drives generators to produce electricity. The technology uses floats that push hydraulic cylinders, converting wave motion into renewable energy through biodegradable hydraulic fluid-driven generators. Pfizer and BioNTech have announced positive results from their Phase 3 trial of the LP.8.1 adapted COVID-19 vaccine. The trial involved 100 participants and showed a strong immune response in adults aged 18 to 64 with risk factors, as well as seniors aged 65 and older. The safety profile of the vaccine was consistent with previous data, with no new safety concerns identified. The vaccine elicited at least a four-fold increase in neutralizing antibodies against the LP.8.1 sublineage, indicating potential effectiveness against circulating variants. These findings have been submitted to the FDA for review, which could lead to broader approval and use. The companies are continuing development, regulatory review, and manufacturing efforts to address emerging variants. Over 5 billion doses of Pfizer-BioNTech vaccines have been distributed globally, with the updated vaccine recently receiving FDA approval. Despite the positive results, Pfizer's stock decreased by 2.25% to $24.32, and BioNTech's stock fell by 8.33% to $103.10, reflecting market caution. Safety information continues to emphasize monitoring for side effects such as allergic reactions and myocarditis, especially in younger males and high-risk populations. The recent data supports FDA approval of the vaccine for adults 65 and older, and for those aged 5 to 64 with underlying conditions. The vaccine aims to improve immune responses against multiple SARS-CoV-2 variants, including the LP.8.1 sublineage. The companies clarified that this new data reinforces existing findings and does not replace post-marketing commitments. These results align with preclinical data supporting the recent FDA approval, demonstrating improved immune responses against circulating sublineages. NASA's James Webb Space Telescope is studying the exoplanet TRAPPIST-1e, which orbits within its star's habitable zone where liquid water could exist if the planet has an atmosphere. Initial observations faced challenges due to contamination from the star's magnetic activity, especially star spots caused by the red dwarf star's magnetic flaring. These issues made it difficult to conclusively determine whether TRAPPIST-1e has an atmosphere or is a bare rock. Scientists used JWST's near-infrared spectrograph to analyze starlight passing through the planet's atmosphere during transits, but the data from 4 transits was affected by stellar activity. The analysis suggests either the planet has a secondary atmosphere with gases like nitrogen, or it lacks an atmosphere altogether. To clarify these findings, Further observations are planned to analyze additional transits and improve data quality. Researchers developed new models to distinguish atmospheric signals from the star's light, marking progress in studying planets around active stars. The research was published in the astrophysical journal Letters on September 8th and is part of the JWST TST DREAMS program involving over 30 scientists from the UK, US, and India. Experts note that understanding atmospheric composition is vital for assessing habitability, with nitrogen and oxygen-rich atmospheres being key indicators. TRAPPIST-1e may have surface conditions like a global ocean or ice-covered areas and is likely tidally locked, with one side constantly facing its star. Tevogen Bio Holdings has reported promising early results for its experimental COVID-19 therapy, TVGN-489. In Phase 1 trials, the therapy demonstrated safety and tolerability, with nasal PCR tests showing over 88% viral elimination by day 4 and more than 99% by day 14. The treatment also elicited a durable immune response, with cytotoxic T lymphocytes detected for up to 6 months, and remained effective against viral mutations, including the XFG SARS-CoV-2 variant. Notably, 2 cancer patients treated with TVGN-489 were able to undergo stem cell transplants without COVID-19 reactivation or complications. The company envisions applications for both acute COVID-19 and long COVID cases, especially those with persistent viral reservoirs. Based on U.S. revenue potential from oncology and specialty care, Tevogen has estimated the value of TVGN-489 at between $9 billion and $11 billion, though this does not include broader platform value. The valuation considers only the U.S. market over 5 years and excludes the potential of the ExactCell platform and international markets. Tevogen plans to update its valuations as it advances additional assets, including TVGN-930, which targets Epstein-Barr virus-associated malignancies and is projected to generate about $3.5 billion in 5-year revenue. Despite these early promising results, the company acknowledges uncertainties related to market performance, regulatory hurdles, and the need for further capital. Institutional investors like Vanguard and BlackRock have increased their ownership stakes, and Tevogen secured $1 million in grant funding from KRHP LLC to develop its AI-driven drug discovery platform. The company's forward-looking statements highlight growth plans, but also emphasize the inherent risks in biopharmaceutical development. As it progresses through clinical trials and regulatory processes, Tevogen plans to provide further updates on its valuation and pipeline. Recent research highlights the potential of blood-based biomarkers for early detection of Alzheimer's disease, which could make screening more accessible. Currently, tests like the LumaPulse GP-tau 217 and A-beta 242 plasma ratio are costly and limited to specialized labs. New studies show that elevated blood levels of neurofilament light, NFL, and glial fibrillary acidic protein, GFAP, are linked to self-reported cognitive issues, even in healthy individuals. Higher NFL levels correlate with subtle memory and thinking complaints, suggesting they could serve as early indicators. These findings could lead to more inclusive screening methods, allowing for earlier interventions. The research emphasizes the importance of including diverse populations, especially underserved communities, to better understand how social factors influence biomarker levels. Supported by grants from the National Institute on Aging, the study focused on over 5,700 Hispanic and Latino adults aged 50 to 86. The goal was to explore how blood proteins like amyloid beta, tau, NFL, and GFAP relate to cognitive decline. Researchers at UC San Diego found that blood tests could provide a simple, affordable, and less invasive way to diagnose Alzheimer's early, particularly in Hispanic and Latino populations. The study found a link between self-reported cognitive decline and certain blood biomarkers, advancing early detection strategies. Published in JAMA Network Open, the research underscores blood biomarkers as a faster, less invasive alternative to neuroimaging and cerebrospinal fluid analysis. Interestingly, amyloid beta levels did not significantly relate to subjective cognitive decline, highlighting challenges in using amyloid markers for early detection via blood tests. Before these biomarkers can be used routinely, issues like standardization, cost reduction, and regulatory approval must be addressed. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.